Starting solids with your baby. I'm Pediatrician Dr. Tanya Altmann, and today we're going to talk about starting solids. So most pediatricians recommend starting solid food when babies are around 4 to 6 months of age, when they're ready. Every baby grows and develops differently, and so some signs to look for are when your baby has good head and neck control. They don't have to be able to fully sit up on their own yet, but they have to be able to hold their head and move it around. They also have to be able to move the food from the front to the back of their mouth with their tongue. If they just push it out, they're not ready yet, so wait another week and try again. They also have to be interested in feeding. So sometimes you might notice when you're nursing or feeding your baby a bottle, your baby is looking intently at what you're feeding or what you're eating or trying to eat it themselves. That can also be a sign that they are ready to start. So what do you start with? Well, there aren't any strict guidelines anymore like there used to be years ago. I like to start with mashed avocado. Some parents like to start with other pureed foods. There's also a trend on feeding your baby whatever you're eating, as long as it's soft and they can just mash down and take little bites or tastes of it. And it's actually all okay. So I'm gonna talk today about some of the things I recommend, but there are other ways to go about it as well. So if I start with some pureed avocado, fork mashed avocado, or avocado pieces, I usually say give a little bit to your baby and see how they do. Now, don't worry if they make a horrible face, because that often happens with avocado, and I think it's super cute, and I always say take a picture of it and send it to me. Did you know that it can take a dozen tries for your baby to get used to any new item to accept it? So even if they don't like it, don't assume they're not gonna like it in the future. Keep trying it. The goal of starting solids is to get your baby used to eating all sorts of healthy, whole foods. So that means as little processed foods as you can. We don't want added sugar and other things. We want whole, real fruits and vegetables and food. The other goal is to get all the allergenic foods in early, because we now know that early introduction can decrease food allergies later on in life. So that's why many of us recommend getting a little bit of peanut butter, a peanut puff, or other products that contain peanut or almond butter into your baby's diet early on. Now, don't forget that whole nuts and other sticky, lumpy things can be a choking hazard. So that's one of the items that you want to be careful and not give to your child. The other item your baby can't have is raw honey under 1 year of age because of the risk of infant botulism. But otherwise, you can try a variety of almost any other food, and always talk to your pediatrician if you have any questions. Dairy and soy are also highly allergic foods that I like to get in early, so whole milk. Baby yogurt is another good first food for your baby. You can also take a little bit of fish. I used to puree salmon up and mix it with sweet potato for my boys. And it doesn't mean they would only eat pureed food. I would give them pieces of food on the side, like blueberries cut in half, and other items that I'm eating like watermelon to just suck on and take little bites or chunks of. And as they get older, the goal is to get your little ones eating at the table with the rest of the family by 1 year of age. And the progression is really gonna depend on your baby. Some needs purees longer, some can handle pieces sooner, and I've seen 6-month-olds that can eat at the table, and I've seen 10-month-olds that are just starting to finger feed themselves with the pincer grasp, and that usually develops around 8 or 9 or 10 months of age. One other highly allergic food I like to get in early are scrambled eggs, and that can be a great finger food to give your baby. So another question that parents ask is, what happens to the breast milk or formula? Well, usually breast milk or formula increases as you hit about 6 months of age. You start solids and then it slowly decreases. But it's still gonna be a major portion of the food and nutrition and calories that your baby is getting in until around 9 to 12 months of age, when it drops down even more. Any questions about the starting solid process, always talk to your pediatrician or enlist the help of a pediatric dietitian. If you and your little bub enjoyed this starting solids video, please like and subscribe below.